Hi, this is Dr. Kevin Smith. Thank you very much for checking out this video on hidden secret number 1 of why you may still have back pain. In this video, in hidden secret number 1, it is due to a muscle strain. A muscle strain is when you have an injury to the muscle or the tendon of the muscle, which results in small tears in the muscle fibers that's caused by overstretching. Now, there's a lot of different reasons why this may happen. It could be due to playing sports, it could be due to an automobile accident injury, or getting hurt on the job, or lifting something very heavy, or any other type of mishap that results in a damage to the muscle or the tendon. Now, there's a couple different ways that people commonly will deal with this problem. The most common way, the medical approach to treating this problem, is by prescribing some kind of a medicine. Frequently, medical doctors will prescribe a non-steroidal anti-inflammatory drug such as ibuprofen or aspirin or naproxen sodium, which is Aleve, or they will also prescribe what they call RICE, which is rest, ice, compress, and elevate. Now, I happen to agree with the RICE concept. I think that during the initial inflammatory phase of the injury, you should rest, you should use ice, you should compress the area, and you should elevate it to reduce swelling and edema. However, I don't agree with the drug solution, and the reason why is because it's non-specific, it doesn't fix anything, and number two, it's toxic. Every single drug that you take, regardless of what it is, has to be metabolized out of the system, and it is toxic. And specifically, non-steroidal anti-inflammatories are damaging to the kidneys, the liver, the stomach, the gastrointestinal tract, and the brain. And you need to be very well aware of that risk before you start taking those types of pills. The next problem that you need to be aware of is that when the body gets injured, it tries to heal and repair itself. And with a muscle injury, what happens is that the body starts to lay down collagen to try to restore and repair a problem in the muscle tissue. Now, the muscle tissue, normally, the fibers run parallel with each other. Think about a bunch of little ropes that all run in the same exact line. But scar tissue formation, which is what the body lays down to try to patch the problem, it lays down the fibers this way and this way and this way, and all kinds of different random patterns. And the result of that is that the area that is trying to be repaired is never going to be as strong as it was before the injury, especially if it is not rehabbed correctly. So what's the solution, and how do you try to prevent that random laying down of collagen fibers and try to restore the involved area back to its pre-injury status? In my office, we use a method called mass correction. And MASS is an acronym that stands for motion, alignment, and strength. I restore motion to the joints and to the muscles, followed by restoring alignment to the posture and to the pelvis, and then followed up by strengthening exercises that are designed to stabilize and then strengthen the muscles. And I found that by restoring motion, alignment, and strength in that specific order, I'm able to get the patient back to pre-injury status while minimizing scar tissue formation and getting them back to pre-injury status. And I really do believe that that is the best approach for treating muscle strains. If you have any questions, if you'd like to talk to me about these muscle strains or any other type of issue relating to back pain, please feel free to communicate with me through my office. I can be reached through my website at redapplewellness.net. Please subscribe to my YouTube channel and please tell a friend. And thank you very much for checking out this video.